Good evening. This is Dr. John Bennett, broadcasting from Miami. We have tonight another one in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, a neurologist from Toronto, Canada. And today he's going to talk about activities of daily life. Difficulty in activities of daily life in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you tonight?
Very good, very good. Okay, I didn't know what ADL means. I thought of attention deficit, but wait, where'd the L come from? Okay, how does Parkinsonism affect activities of daily life?
As you know, Parkinson's disease usually starts on one side of body. Either it involves one side only at the beginning, if it is at the very onset, or it's asymmetrical. One side is affected more than the other side of body. So in those individuals in which symptoms start on the left side of body, issues in the beginning of the course of disease with their activities of daily life, they can write easily, fasten their buttons, put their socks and shoes, or tie shoelaces, trim, and comb their hair without any problem, except they might have a bit slowness of movements. In the past, this has been used sometimes to watch these patients before starting medications. So these patients were just watched, and the medications were not started as long as it was not affecting their basic activities of daily life. Once the symptoms of Parkinson's disease were involving these activities, then these patients were started on medication. But now most experts suggest that the treatment should be started at the diagnosis of Parkinson's disease. In those individuals in which the disease starts on the right side of body, so they may have trouble from the beginning with the dexterous movements involving writing, combing their hair, or dressing, or putting their socks, tying shoelaces, or showering, putting their sleeves in their dress, etc. So these problems may increase as the course of disease progresses, and they may not be able to do these things from the beginning if the disease is right-sided, or if the disease is involving more left side. When the disease becomes bilateral in right-handed individuals, they start noticing these issues. So they may need help with dressing and washing, and shaving or brushing their teeth. They might need to use the electric toothbrush. In due course of disease, so these activities are involved, nevertheless, whichever side the disease started, and this get progress with the course of the disease.
How is this difficulty in activities of daily life managed?
These problems do improve partially with medications in those patients who are newly diagnosed and they have these problems. So when you start these patients on levodopa or other dopaminergic medications, they would report that they can write better, or they can do these activities better. Their hand-mouth coordination improves, and they can do their buttons, or take care of their dressing, or activities of hygiene care themselves, especially early on in the disease course. But as the disease progresses, you need to increase the dose of medications, or sometimes the interval between the two doses of levodopa may need to be decreased. So these activities could be affected sometime in the advanced stage. Only in the wearing off periods they are affected most, and when they are on, patients still have some trouble, but they can manage these things. Otherwise, as the disease course progresses, beyond stage 3, most experts think that the medications may not be even helpful to that extent as they were helpful in the beginning of the course of disease, and they may need help of the caretaker or their family members to do their activities. Therefore, we tell family members or caregivers when they accompany these patients in the beginning that yes, when their loved one is diagnosed with Parkinson's disease, in the beginning, their duties may only be giving them emotional support, but as the disease progresses, they would need their physical support as well.
What are the other resources in the community that aid the patient with difficulty in activities of daily life?
As the condition of these patients progresses, so they become more dependent upon their caregivers, and caregivers in case they are a spouse or they are elderly themselves or their healthcare issues themselves, so they can do things to a certain extent, and then a time comes when these patients may become more and more dependent in stage 4 and beyond that, and so they need the help of someone on 24/7 basis, and even for their basic day-to-day activities and personal care as well. So these patients at that stage, they may have to think of placement in the facilities where these sports and assistance is available on constant basis. So in every community, different resources are available. Here in Canada, in most parts of Canada, we have several levels of these facilities which patients can be placed, and their care can be delivered reasonably well. Usually the first level is a supportive housing in which there's a personal support available. It's a building, and with the personal support, it is more affordable than a retirement house, and the cost of the care is based on the income of the patients. The patients may have to show a proof of income or a notice of assessment before applying for this, and usually there are several locations in every community. However, there could be a waiting list. The patients have to go through that, and another level is a retirement home. In the retirement homes, patients have independent apartments. Each resident has their own apartment, and the supportive staff is available on 24/7 basis. Usually there's a nurse as well in the facilities, and these patients get their meals prepared, and they are, however, expected to go to the dining room to eat. However, if a patient is sick or feeling unwell, the food can be brought to their room, and the cost of the retirement homes is usually not regulated by any agency, and it could be dependent upon the location or the services which are provided in certain facilities, and the patients may be able to purchase a plan including their daily support and their other activities. They could have a personal support worker as well. Some patients can have room service, or they could have the laundry and all these facilities included. And usually their medications are provided by the home, and there is a nurse which would dispense these medications. The final level is usually a nursing home, which are usually present in most of the communities, and they provide a 24/7 care to each resident, and not only they have a personal support workers, but they have 24-hour nurses. Usually they have a physician who makes the rounds and is in charge of the care of these patients. The nursing homes may have different wards. They might have semi-private or private rooms, and the price is again based um, upon various factors, and the price is usually usually controlled by the Ministry of Health in that areas. However, there could be subsidized rates for patients who have low income, but those patients would have an accommodation which would be like a small ward, up to 4 people in a room. So the local CCAC or Community Care Access Program usually files an application for these patients. There is a coordinator and a social worker. If these patients are in the hospital, then there is a extensive paperwork to complete, and there is also a medical evaluation which has to be completed by their family physician or a referring physician before these patients can be placed into a nursing home. Patients who are living in the community in their own homes or accommodation, they could get services of Community Care Access Program, CCAC, and this program provides a supportive service for these people who have limited abilities. So they could have a personal support worker who would visit the home of a patient, and they would provide 8 to 10 hours of service per week to the patients who have high needs or who may be bedridden. So these personal support workers may be responsible to assist patients in bathing, dressing, changing of their bed linens, and sometimes the nursing services could be available in patients if they need any injections or monitoring of medications or vital signs. So for this, usually a physician has to fill the forms for the services needed by that particular patient, and sometimes a social worker may visit the community to follow up on the financial issues or a housing problem or any other social issues. And at times, if patients have specific nutritional or feeding issues, then dietitian may be able to make a visit and advise these patients and monitor if they are on tube feeding. And sometimes if the physical activity is necessary, then physiotherapists may be able to go out in the community and visit these patients.
Very good, doctor. Anything else to add before we close on this topic?
The difficulty with the daily activities is usually an expected outcome of Parkinson's disease in all patients. A stage comes to that level when they can't complete these activities. They become dependent. So when we stage these patients, this is Cohen and Yar stage 5 patients who are completely dependent upon others. So these patients should be mentally prepared because that makes them to accept this stage and be ready for this in future, and also decreases their anxiety for this. So in addition to this, these patients should try to have their will prepared beforehand in case there are decisions about their healthcare and personal or financial issues in a condition when they are not able to express their desires, so they could be carried out according to their will, which was prepared beforehand.
Okay, very good. That brings us to the end of this educational video on difficulty and daily events, daily activities with Parkinsonism patient. Thank you very much, Dr. Rana, and we'll see you tomorrow night.
Thank you, Dr. Bennett. See you tomorrow.
Good night.